Total knee replacement surgery is no joke. It's an extensive procedure that requires quite a lengthy and challenging recovery at baseline. And the last thing you want to do is make it even more difficult. So in today's video, we'll be covering the top 5 mistakes to avoid after total knee replacement and what you can do to enhance your recovery. So if you're thinking about having a total knee replacement or already underwent the procedure, this video is for you. Hey everybody, welcome back to another episode of Physio Show. My name is Dr. Bob Datillo and I'm a physical therapist with a specialization in orthopedic physical therapy. And I treat total knee replacements all the time. And when you treat certain conditions often, you notice a pattern of recovery, some good and some not so good. And total knee replacements are no different. Some people do great, while others have a tough time with recovery. The first mistake I see people doing right out of the gate is relaxing or sleeping with the pillow right under their knee. This is the worst thing you can do fresh out of surgery. And I get it, this feels good on the knee as it puts it in what we call the open pack position, which is the position where the knee joint is at its most relaxed, taking pressure off the knee. But if you do this consistently for a long time, you are likely to develop knee stiffness, making it hard to straighten your knee, and you need to be able to straighten your knee to walk properly. Sometimes I don't see people after their total knee replacement until 4 or 6 weeks after surgery, and I can tell right away those who have been keeping their knee bent. And I'm telling you, as much as this is a comfortable position to be in, it's going to get even more uncomfortable if we have to crank on that knee to get it to straighten out. So make sure to keep your legs straight while you are lying down or sleeping. The second mistake is not moving your knee enough after surgery. Total knee replacement is painful. You're going to be swollen, and your knee is going to feel like it's been replaced. Have you ever seen a video of this procedure? I suggest avoiding doing so if you're squeamish. But the point is that this procedure is very invasive, resulting in extensive trauma to both muscle and bony tissue. So it's not surprising that there will be discomfort after, but you absolutely must move that knee early and often after surgery. This is necessary to help reduce swelling, regain mobility, and reestablish muscle function. Because believe me, you don't want to be dealing with a stiff knee. It's very hard to regain mobility once the knee starts to stiffen up and may even require additional surgery to fix it. So let's avoid that. Make sure to take the pain medications your doctor prescribed, eat right, hydrate, prioritize sleep, and make sure to manage your stress. All of these strategies have been shown to help reduce pain so that you are more willing to move your knee. The third mistake is getting off that assistive device too early. And I get it, walkers and canes are for old people, right? Well, no. They're for people with walking issues, which you're likely to have after surgery. And what these assistive devices will do is help to normalize your walking so that you are not reinforcing a limping gait pattern, which places stress through other parts of your body and does not expose your surgical knee to the normal walking forces it needs to recover and regain its conditioning. And this is only for the first 2 to 4 weeks or so after surgery. Once you demonstrate good strength in your quadriceps muscle, controlled pain, and normal walking mechanics without an assisted device, then you can toss it back into the closet. But do yourself a favor and use the assisted device after surgery until your therapist gives you the clearance to ditch it. The fourth mistake is not focusing enough on regaining quadriceps control early after surgery. We did an entire video on this issue with persistent weakness after total knee replacement, which you can find by clicking the link in the screen. This is a huge issue after total knee replacements, with those who had surgery being shown to have upward of 30 to 48% less strength in the operative leg, which is a significant amount of weakness. Which is why many continue to struggle with stairs and squatting after surgery. They simply don't have enough strength in the operative leg to control their body during movement. And this will inevitably put additional stress on other areas, such as your other leg and low back. Research shows that patients who utilize a neuromuscular electrical stimulation device can accelerate quadriceps strength recovery following total knee replacement surgery, compared to those who did not use the device. I provided a link to the electrical stimulation device in the description that can be purchased and used at home after surgery, but make sure to consult your therapist prior to using. The fifth mistake is insufficiently strengthening the operative leg after surgery. After the first 12 weeks, once pain is controlled, knee motion has been improved to acceptable ranges, and you have returned to normal daily activities without significant issues, it's now start to progressively strengthening that leg. But unfortunately, this is where many stop structured rehab. And unless the therapist sets you up on a really good gym-based strength program, and you actually do it, you're likely still dealing with residual weakness from the surgery, which doesn't magically go away. Over 30% of people who have had a total knee replacement report dissatisfaction with their ability to get around over 1 year after surgery. And this is despite typical rehab. And I believe this is because rehab ends too early, and patients tend not to finish out the last phase of rehab, which would focus on progressive strengthening. Because even if you did some strength exercises during rehab, it likely did not start until 8 weeks after surgery. So most only get exposed to about 1 month of strength exercises before they are discharged, which I would argue is not nearly enough. This is because the load or weights that patients are asked to move or lift are likely not heavy enough to result in true strength changes. It's likely just enough to build some endurance and some muscle hypertrophy, where the muscle begins to get slightly bigger in size. But to elicit true strength changes, you need to lift weights that exceed over 75% of your 1 repetition maximum. So if you could lift 100 pounds for a maximum of 1 repetition, you would then exercise using weights of 75 pounds, typically for 2 to 3 sets of 3 to 6 repetitions. So the moral of the story is that once pain is controlled, knee mobility is good, and you have sufficient muscular control and endurance with basic exercises, it's time to increase weight. This will result in true strength gains, which have been shown to translate to improved functional movement. So I suggest if you're being discharged from physical therapy, get a gym membership. You need weight to increase strength. And unless you have a home gym, those TheraBands and bodyweight exercises are not going to cut it. Ask your therapist to help design a gym-based program for you. Well, there you have it, the top 5 mistakes to avoid after total knee replacement. If you found this video valuable, please take the time to give the video a like to help it spread and help more people like you. And subscribe to the channel so you can continue learning more about your body, how it works, and what it needs to keep moving.